Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Right. Some important points about tubercular meningitis, especially the exudate. In tubercular meningitis, the exudate is mainly basal in the tubercular meningitis. So that means the basal brain is involved in tubercular meningitis. In tubercular meningitis, even the subarachnoid space is filled with exudate. So because the subarachnoid space is also filled with exudate, the patient with tubercular meningitis will present with subarachnoiditis. Then, tubercular meningitis. The clinical features of tubercular meningitis are very slow and they develop over weeks to months in the patient. Okay, if the presentation is not weeks or months, if the presentation is hours to days, then you can exclude the tubercular meningitis, because tubercular meningitis presentation will be very slow with over weeks to months. But if in any case, if the presentation is hours to days, then we can exclude the tubercular meningitis.
thank you and thank you for watching.